Before we begin, we'd like to thank the Amgen Ireland team for their generous sponsorship and continued support. Welcome to another episode of Oncology Spotlight. For today's episode, we are exploring the world of haematology. Thanks very much for joining us today. To kick off, can you give us a brief introduction of yourself and your background, Jar?
Yeah, thanks very much for giving me the opportunity to do this podcast. My name is Geraldine Walpole and I'm an advanced nurse practitioner in Sligo University Hospital. I've been nursing for 30 years, 27 of which have been in haematology oncology. I trained at St. Vincent's University Hospital in Dublin and worked there for many years. And then my first job as a nurse specialist was in Galway University Hospital with Professor Ernie Egan, and then Professor Michael Dwyer came back from America, and I was his first CNS, so that was a really exciting time in Galway. He was very popular at the time. And then I moved across to Sligo in 2003 to set up the new haematology unit from scratch with Dr. Andy Hodgson, who I'm still working with now alongside Dr. Anya Burke. And I was an AMP with them a clinical nurse specialist with them for 16, 17 years. And for the last 6 years, I'm an advanced nurse practitioner.
Very good, very good. And what inspired you originally to become a nurse?
It's something I kind of fell into, to be honest. My family are full of nurses. Loads of my aunts were nurses. My sister was a nurse. And it really wasn't on my radar. I had applied to go to college, and then I went with my friend to do work experience in a hospital because she wanted to be a nurse, and I went with her for the week, and I ended up loving it and deferring my college place and said I'd give it a try, and if I didn't like it, I'd go to college, and I never left.
Cool, very good. And why haematology and oncology? What led you to that specialty?
Yeah, so when you're doing your training as a student nurse, you move around all the different departments, and I liked most of them, and maybe intensive care I thought I really liked, but this is the first week that I worked on my oncology rotation. It just clicked. I said, this is what I want to do. I loved that you got to know the patient so well. You just didn't look after them and discharge them and never see them again or wonder what happened. So you saw them again and again and again. You got to know them. You got to know their families, and it was real continuity of care. And you had a great experience journeying with them on their cancer journey.
Brilliant. That sounds really inspiring. And can you tell us a little bit about the work you're doing in Multiple Myeloma Ireland? I understand you're the chairperson there.
Yeah, Multiple Myeloma Ireland. So it's a charity that supports patients with multiple myeloma. And we're a board made up of nurses, patients, carers, and doctors. And we advocate and promote for patients with multiple myeloma. Even though there's about almost 400 patients a year diagnosed with multiple myeloma in Ireland, and people are living much longer. So we've lots of people with myeloma in Ireland, but still there's very little known about it. So we really want to promote awareness. We want to advocate for the patients. We want to educate them and provide education for them. So we facilitate that through Myeloma Ireland through various different campaigns and networks.
Okay, great. Can you give me an example of one of the initiatives you guys?
Yeah, so we've recently just rebranded and updated our website, and there's loads of great information up there. Once a year we hold a patient and family day, where we bring all patients and their family members together in a different location, in Athlone or Dublin, for a day, and we provide speakers for them to talk about all aspects of their diagnosis. So not just the treatment and the side effects, but psychology, dietetics, physiotherapy. We really, really promote living well with myeloma, and that we make the best out of it, because it is an incurable cancer still, and there's huge work going on to, someday that it won't be. But at the moment, when you're told you have myeloma, you've got an incurable cancer. So we're trying to make it as tolerable for people and that they can live with it. We had our last patient day in September, and a wife of a patient said something to me that really, really stuck with me. She said, days like today are so important for us to meet other families that are going through the same thing. She said, because myeloma comes in the front door and it doesn't go out the back door. And I
Yeah.
just thought it was so, it was so powerful.
Mm.
And that's the reality of it. During COVID, patients really struggled because they couldn't bring anybody into the hospital with them, especially when they were being diagnosed and getting all of this information. So we noticed a huge void of information out there, and we have a nurse supported helpline. So there's a number on the website, and there's 4 nurses on the board, and we take a year each with our number up there. So my number was up there during COVID, and there was a huge increase in calls to the telephone. So we knew then that we needed to do something. So that's when we developed our own podcast series, and we have a big podcast series on the website. So that when, if a husband's wife rang me and said he came home and I don't know what he was told, I don't understand, you can talk to her and then you can direct her to the podcast. Any of our information days, we put the talks up there. We interview interesting cases and patients or doctors. We put the interviews up there. We have a medical writer, and then we facilitate support groups all around the country. So we have support groups in I think it's 9 support groups we have, and we give them money to help run them during the year, and then the nurses facilitate them. And usually we try, where possible, to have them outside of the hospital, so that they're where it's separate to the sick part of it, and that they can network more easily. And we do a lot of funding for grants, and we give doctors research grants to do research in myeloma and then present it at our patient day. And in September, actually, we're having our first staff nurse education day, because we really feel that we need to start at the grassroots, and we need to start encouraging nurses into haematology and, explaining the situations and the diseases better to them. And then our biggest event every year is our annual cycle. It's called the Wild Myeloma Way, and that's on next weekend. And it's in Sligo this year, which is great. It moves around all the time. And it's full up today. My phone was hopping all day with people looking to do it, and we can't take any more people. And that's a huge awareness campaign. It's brilliant.
Brilliant. But how many people are on that?
70. Yeah.
70. Great.
So we have to cap it at 70 for safety. We've patients as well doing it. We have doctors, we've friends in pharma, and then just members of the public and family members. So it's a great event, 2-day event.
Excellent. That's brilliant. For anyone listening to this, could you kind of explain multiple myeloma and what's the typical patient, and what's their symptoms and how is it diagnosed, etc.
So it's a cancer of the blood and bone marrow, and it's caused by an abnormal production of these things called plasma cells, which are normally your good immune system, but these are myeloma cells. They're cancerous cells, and they originate in the bone marrow. So sometimes it's an incidental finding. There's an abnormal protein in your blood called a paraprotein. So you might have some reason gone to your doctor, and he may have checked a paraprotein because he had a hunch there was something wrong with you, and we might just get a call to say, there's this man with a paraprotein of 20 grams, you need to see him. Or because it's a cancer of the bone marrow, and bone marrow runs through the center of our bones, when the myeloma starts getting very active in there, it tries to explode out of the bone, and it causes all these little holes in the bones, or lytic lesions, which makes your bones weak. So you may present with just a fracture that you can't recall having an injury for. It can also affect your blood count, so you could have a low hemoglobin or be anemic, and it can affect your kidneys, so you might have a high kidney reading. So it's a bit of like putting a puzzle together. Somebody has to have a suspicion, and then they start the process. And usually the first thing will be to see, have you got this abnormal protein in your blood or urine? And then if you do, the next step would be a bone marrow test, where we take off 2 pieces of bone marrow, a piece of the fluid called the aspirate, and then a piece of the bone called the trephine. And we look at that in great depth, and we look at the genetics of it. And that tells us an awful lot about your type of myeloma, because everybody's myeloma is different, and the genetic makeup of it is different. And that's really important that we know that, so we know what drugs will work best for that patient. And then we obviously image all their bones. So we do a CT scan or a PET scan of all their bones, and various blood tests, and then decide on the treatment plan.
Okay. And is there a typical age profile? Younger, older patients, or?
So it used to typically be more male than female, and kind of men in their 60s, but we are definitely seeing a younger profile. We're seeing all age groups. We see people as young as their 30s and as old as their 90s. So the age profile is definitely changing.
Okay. Is there any reason for that change that science is
I
aware
think we
of?
might be getting better at diagnosing it. I think GPs are getting more education and awareness, and because we're seeing more myeloma, we're thinking about it more. And yeah, I suppose the population's getting bigger. It's just, yeah.
Yeah. Now, have you seen any breakthroughs in the last 10 years or so in myeloma? Any new?
It's been unbelievable. It's been just so exciting. Like 10 years ago, a diagnosis of myeloma was a tough diagnosis, and the treatments were very, very limited. And at that time, the average lifespan was 5 years, was the most you could hope to live. In the last 10 years in particular, there has been like such an explosion of new drugs and research and development. And it's really, really improved the whole landscape of myeloma. As they produce the drugs, they're getting better every time. They're getting more tolerable. There's less side effects. And now I suppose in the last kind of year or two, the two big groups that we're looking at are the BiTE therapies and the CAR T therapy that everybody's hearing about on the news. And we now have a CAR T therapy clinical trial for myeloma opened in St. James's Hospital. So that's the first CAR T centre in Ireland. So that's brilliant.
That's great news. And do they think CAR T can actually cure it, or is it just maintenance therapy?
That's what they're trying to do. Who knows?
Yeah.
You know, it'll take time, definitely. At the moment, it's only available on clinical trial in a certain subset of myeloma patients. But I think we will see when it's approved. It's a very expensive process. We will see, I think, a lot more of it in the future, and a lot more of these BiTE therapies. And at the moment, there's a lot of these new treatments available on compassionate access, and the biggest issue is waiting for them to be funded. And we're using them in patients that have had a lot of other treatment, whereas it'll be really exciting to see when they are approved and used earlier on in the diagnosis. I think they're going to have a great effect.
Brilliant. That's brilliant. How can healthcare professionals stay updated with the latest developments in haematology? You know, what do you do to stay up to date in haematology?
Yeah, so you really have to keep, it's moving at such a pace, especially in myeloma. You really do have to keep up to date, and it can be difficult. I think one of the few advantages of COVID was that we now don't have to go to every meeting, and we don't have to travel to all the conferences. All the online meetings, the webinars, the podcasts, there's so much more online that we can tap into and we can access. We have a national Haematology Association of Ireland, which is a very strong group, and it's medical and nursing. And we work very, very closely together, nursing and medical. In haematology, it's very tight. And we have an annual conference every year, and we run the medical and the nursing alongside each other, so that we all get to meet for the weekend and network. And some of the medics will come in and talk to us, and we'll go in and talk to them. So it's not just a nursing conference or a medical conference. And then we have a separate spring nurses study day as well for people working in myeloma and other hematological disorders. And we all know each other. It's a small enough world. We all know each other very well. So if you ever have a problem with a patient, if you had anything, that was tricky or you weren't sure of, you'll always have somebody that you can call. And then, of course, we have these multidisciplinary team meetings across our hospital groups now. So any patient diagnosed with myeloma in Sligo is discussed at a MDT in Galway. And even though he may be under one consultant, maybe 10 consultants will have discussed the case and decided on the treatment. So that's very reassuring for patients, that they know that there's lots of people thinking and talking about them, that it's not just one person.
Of course, yeah, I bet. And what are some of the challenges for you as a nurse, when dealing with haematology
Yeah, so
patients?
at the moment, there's lots of challenges. It's staffing. Staffing is a big challenge, and getting trained staff. The big break in COVID stopped training and development, stopped people going to college to do the higher diploma in haematology nursing. It's a really exciting area, but you have to really want to do it. So it's retention of staff, of course, and then it's trying to access drugs for patients, trying to get the best treatment for patients, and to support them and advocate for them. But I think through Myeloma Ireland, we're making great headway there because we're a strong organisation now, and there's people power there. So that's really helping, and we're like submitting support letters to when they're trying to get drugs licensed into the authorities that are dealing with it. So that's good. And I suppose it's a funny area. You could go in the morning with the best plan in the world of what you're going to do with your day, and you meet one patient who's got bad news, and it could take up 3 hours. And then it's time management and prioritizing what's important, where you need to be, and what you need to do. But yeah, it's I'd say staffing and space and beds are the biggest challenges at the moment. Yeah.
Of course. And you mentioned, you have the good relationship with the haematologists, the physicians. I'm just wondering, do you collaborate with other specialties as well, like oncology and pathology, etc.?
Yeah, we liaise with a lot with endocrinology, because we use a lot of steroids in all our treatments.
Okay.
We'd obviously work very closely with oncology, but they're very separate specialties now. We work very closely with palliative care. We use them a lot, even for symptom management. We like to introduce the concept early, just to help us. Sometimes when people are diagnosed and their disease is very active, they have a lot of pain. So we'll use our colleagues in palliative care for a while, and they'll go again. And they may come and go several times on the patient's journey. So there's no big fear attached to palliative care. And we'd work with all the consultants. Obviously, cardiology, some of the drugs have cardiac effects. So we'd work closely with all of them. And then within our own team, our allied health professionals are really, really important. So our dietitian, our social worker, our pharmacists, like we deal with the pharmacists all the time, obviously. And community pharmacies. I would deal hugely with community pharmacies, because I run nurse-led oral anti-cancer clinics for myeloma patients who are on oral chemotherapy. So yeah, we'd work very closely with our MDT and psychology as well.
That brings me on to my next question. What kind of diet and exercise and treatments beyond the pill would you recommend?
Yeah, it's so important, and that's why we say living well with myeloma. It's that we live with myeloma. Myeloma doesn't live with us. I always tell my patients, you need to be in charge. If myeloma gets in charge, it's all over, because your life will be consumed with it. So you need to live well with myeloma. We really promote exercise. There's so much research to show the benefits of exercise, even during transplant, gentle exercise. There's big emphasis now on prehab. So loads of our myeloma patients would have stem cell transplants. Anybody under 65 more or less is offered it. And that's a very debilitating process. So we're trying now to prehab them, to have them in the best physical shape going into transplant, because it really has been proven the benefits if they are in good shape, instead of doing what we did years ago and wait for them to come out of transplant really weak, and then you're trying to recover them. Diet is really important. And then, we have a cancer support centre in Sligo, and there's loads of them around the country, and we really promote that they go and avail of, psychology, counselling, biodynamic therapy, Reiki, just a very holistic approach, that it's not all about the medicine and it's not all about the myeloma. It's, giving them every help that they need and that will help them.
Of course. So I guess looking ahead, what do you see as some of the most promising developments or trends in the field of haematology? Is there anything in the pipeline that you're really excited about?
I think these new drugs that are all, very close to the finish line, that we are using at the moment, like I said, on compassionate access in advanced stage myeloma. I think it's going to be very exciting when we see them used earlier on. Like a number of years ago, if you had myeloma, you'd be getting what they said, a doublet treatment. That would be 2 different treatments. We're now giving quadruplet treatments. So I think it'll be very exciting to see how CAR-T goes, how the bites go. I'd like to see a lot more clinical trials in Ireland for haematology patients and equal access. So a lot of it at the moment depends on where you live, because it would be impossible for somebody in Limerick or Galway or Cork or Sligo to go to Dublin every week for a clinical trial. So you'd like to see more clinical trials, more funding for clinical trials around the country in other centres. And I think I echo all my colleagues' wish on that. But I think, research, development, clinical trials, and see how these drugs, when they're used earlier, how they're going to, impact.
Yeah, brilliant. And you mentioned genetic testing earlier on. Is that an important part of haematology as
Hugely
well?
important. Yeah, it is, Kevin, because like 5 years ago, you couldn't routinely get cytogenetics on every patient with myeloma, whereas now every patient gets it. But we don't have capacity in Ireland to do our own patients. They were doing it in Crumlin, but it just got so big when everyone was entitled to it. So different hospitals have contracts with different places. So some hospitals send it to Germany, some hospitals send it to the UK. Depends on where it goes. So the marrows are collected by courier and brought off. It can take 3 weeks or more for the results to come back. So obviously you would start treatment, and then if cytogenetics gave you more information that a different drug might work better, you may change. But we would have gold standard kind of starting regimes for kind of every subset. So genetics they tell us, exactly the nuts and bolts of the myeloma, what's going to work, what's not going to work, and it can predict how well the patient is going to do if they've got high risk, moderate risk, low risk. And patients are much more knowledgeable. Even the likes of Myeloma Ireland and patient days and all of that, it makes them very knowledgeable, which is great. So they want to know that patients are now coming asking for cytogenetics, which I think is brilliant. Whereas a few years ago, they wouldn't have known anything about it.
Yeah, that's good to hear. That's good to hear. For anyone who's interested in pursuing a career in haematology, whether it be nursing or as a physician, what advice would you give?
I'd say if you're anyway interested, try it. It's a huge privilege to work in haematology oncology. You really get to know patients and their families. You almost become part of their families. You get to know them so well, and you go through all the ups and downs with them. And there's so much success now. There's so many success stories. Like I'm in Sligo since 2003, and there's still patients coming into the clinic that we would have given treatment to in 2003 in haematology. So it is very rewarding. It can be tough. It's not for everybody, but you won't know unless you try it. And it's a very, very rewarding area, and it's exciting. And there's lots of education, and the pharmaceutical companies are brilliant at supporting meetings and trying to facilitate education for us. So it is an area where you are given lots of access to meetings and education.
Excellent. And final question, what advice would you have for any patients or caregivers who are listening to this?
I always say try and normalize it. Don't build a fear around it if you can, and that's easier said than done. Reach out and get as much information as you can, because knowledge is power. Go to the likes of the Myeloma Ireland website or the CLL Ireland website, get the information, talk to other people, and educate yourself, and don't be afraid, because there's so much drug development out there, and it's really important for us. The patients love when I say to them, I was at a meeting last week, there's this new drug coming. They always want to know that there's more things coming if what they're on doesn't work. And there's great reason to have lots of hope at the moment, because they're really the drugs that are being produced are just amazing. The science that's gone on behind them is just incredible. We're so fortunate with our great scientists and all these people that are very important that probably aren't acknowledged half enough. We're handed the drugs to give, but there's a lot of work in the background. And I would say to patients to be happy with where they're being treated, and that they're comfortable with their situation, and that they look for as much information, and don't be afraid to ask for things. You only get one chance at doing it. So if you want something in particular, or you're worried about something, or you want to talk to somebody else, that's absolutely fine.
Okay, great, brilliant. Well, thanks very much for your time, Ger, and we'll be sure to link to all of the resources you mentioned in the show notes, so they're there for any listeners that they can click through to and learn more, especially your work with Multiple Myeloma Ireland.
Yes, yeah, okay.
Brilliant. Thanks very much.
Great, okay.